Alright, so, this video is going to be something that I don't talk to other people about. Like, I've never talked to anyone about this. It's just kind of my own thoughts and crap like that. So, I typically, okay, this is where it gets complicated already. To pretty much everyone except for the people I work with, um, actually, except for a couple people that I work with, I identify as female to male, transgender, um, but I've been thinking more and more about it lately. Um, I would say I'm more gender fluid, bouncing between gender queer and trans, um, or even trans non-binary. I don't have a specific label that I can put on myself. I have multiple labels that I can put together to describe myself, but I don't feel like there is one specific label that fits me. So, um, typically, I just identify as FTM just because it's easier to explain to people than how I really feel, basically. Um, and since I came out, basically, since I first came out in November of 2012, yeah, since I first came out in November 2012, I've always been like, hey, I want to start testosterone and then within a couple years get top surgery, and that would be it. Well, the more and more I think about it, I feel I don't need top surgery, or not top surgery, testosterone, for the main reason being that that would be to help me pass and basically to help other people I'm around be more comfortable, if that makes sense, because I would be passing and I wouldn't confuse them or anything like that. Which still to this day, like, I would like to do that, but I don't feel that it is necessary, at least at this point in time. I would love to have like a deeper voice and look more masculine, but for now, I. It's so hard to explain. Um, for now, I want to focus on top surgery just because that is the biggest thing I need right now. To help myself feel more comfortable in my skin. Um, and then after that, um, I may or may not start testosterone. It just depends on how top surgery, like how much top surgery helps, basically. But I do know that that is one thing I have to do, one way or another. Um, so I've set a goal because my insurance is great, but as far as I know, it doesn't cover much of any trans related stuff. Um, like, I get most therapists, gender therapists, don't take insurance. However, the few that I have found don't take my specific insurance. Like, I have Blue Cross, Blue Shield, I believe. Um, but I have a specific policy that a lot of therapists don't take. So, but without a doubt, I have extremely great insurance, and I am so thankful for that because that cuts back on other bills. It's just, it doesn't really help with transgender related things as far as I know. Um, Again, I'm still going to be looking into that because I know there are specific things that it covers. It's just more so in my area, the people close to me don't accept my insurance. So yeah, but I am looking for a therapist right now. I work in fast food, so it is practically impossible for me to pay for this out of pocket considering I'm paying for a car, I'm paying rent, um, I have hospital bills um, from right after I turned 18 that are coming in my name now. Fortunately, again, my insurance does cover the majority of those, so it is a lot cheaper on my part, but I don't want to be in debt already, so I'm working on paying those things, as well as I have basic expenses just like everyone else. So, um, yeah. So, um, and another one of the reasons is for getting top surgery first is because of the damage that it's doing to my body. I know binding is not comfortable for anyone, um, but from other guys that I've talked to, like I live with a friend who is also um, FTM, and he's actually already on testosterone. He's about 3.5, 4 months on T, and of course he's smaller in all ways than me. I mean, hell, I'm 6 foot tall, 175 pounds, so I'm pretty big. Although still healthy, fortunately. It's just because of that I have a bigger chest, and it causes more dysphoria, and binding has done more damage to me than I have found most other people that I know. So, yeah. Um, I've tried different binders. It's just the binder I have does the best job out of all of them that I have tried, and it still causes extreme pain, and it can get to where it's hard to breathe. And I'm not even binding for more than 6, 7 hours most times. That's usually the max that I will bind. Um, it's just, it's putting my body through a lot that it doesn't need to go through, and um, I just feel it's best that I get top surgery first. It's more so coming up with the funds to do that. So again, since I just kind of got sidetracked now that I'm thinking about it, I've set a goal before my 21st birthday, which will be what? 2017, November 2017. I will be turning 21. Before then, I plan to get top surgery. I already know I'll have to get double incision and definitely a nipple reduction. It's really embarrassing, but yeah. So right now I'm kind of just doing my research on finding a doctor that I would feel comfortable going to, because personally I want as light of scars as possible, especially since I'm so pale anyways. Uh, as light as scars as possible. I know a lot of people care about drains. Personally, it doesn't matter to me. It's more about the outcome that it's going to end up coming out to be, rather than the process of which I have to go through. Um, Although I don't want to have more than one surgery, like I don't want to have to go back for revisions or anything, which is why I'm basically just doing research right now on which doctor I want to go to see their outcomes, and if people have to go back for revisions or anything like that. And if I get lucky, it'll be a miracle if I can get my insurance to cover it. If that is possible, I will do it even sooner. But I'm setting a goal to start saving as much as I can here and there, which right now seems impossible, but um, I'm going to try my hardest and see if I can do it. on my own. I don't want to have to ask other people for money or anything like that. And um, yeah, so right now I'm just kind of focusing on saving up to be able to do that. And yeah, so thank you guys for watching. I hopefully will post another video at some point. Honestly, there's no guarantee. It's just um, I don't really know what to talk about sometimes, so I just kind of go with the flow. So if I have an idea for a video in a week, then I'll post a video in a week. But otherwise, just hang in there, I guess. Alright, so thank you guys for watching, and yeah.